You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, he says nobody should be wearing a loose-fitting denture. He's Mesa's go-to dental implant dentist, Dr. Abe Miller. Dr. Miller, welcome to the program.
Randy, thank you so much for having me on.
Now, you brought some photos, so we'll kind of get to those in a little while. But for people that don't know your practice, like who's the typical dental implant patient?
Well, Randy, I have two typical patients. I don't want to say I have a typical patient, but they typically will fall into two categories. Number one, the patient that comes to see me, they've been wearing a denture their whole life, and they're sick of the denture glue. They're sick of them being loose, and they've been told that they're not a candidate for implants, and they kind of feel hopeless. Okay. And so those patients are going to come and see me, and they're going to come in with a denture that doesn't fit, and in the same day they're going to walk out with permanent teeth, with a permanent smile.
Upper and lower teeth that don't come out.
Upper and lower teeth that don't come out.
Is that rare?
No, it's very common.
Okay.
I have patients that come to see me all the time that have been told at a previous dentist that they're not a candidate. I'm able to look at those patients and quickly determine if they're a candidate for permanent teeth or not.
Now tell me this though, because isn't it true? I mean, if you've been wearing a denture like 10 or 15 years, you can't do this. You don't have enough bone to get dental implants.
I've had patients come into me that have been wearing dentures for 20 to 30 years and have been told at other offices that they're not candidates for this procedure.
Okay.
And at my office, they're able to walk out of my office the same day with teeth that don't come out. I had a patient that was in a denture for 25 years, was told they were never going to be able to have implants, and they felt pretty hopeless. She was miserable, didn't want to go out, came to see me, told me her story, and the next day she walked out of my office with permanent teeth that don't come out.
So no more dentures. It's
no
not
more
an
dentures.
exaggeration.
No more dentures. Not an exaggeration.
Who's the second group of patients you see?
The second group of patients I see are those that have teeth that are maybe falling apart, loose, broken teeth, have a lot of frustrations with their ability to eat and chew. Maybe they wear a partial denture. Maybe they have gaps, missing teeth. They're not happy with their smile.
Do they feel like they're going to end up in a denture eventually?
I think a lot of people, they feel like that's going to be their ultimate goal. They think, so then what happens then is they think I'm going to end up in a denture, so they kind of stop taking care of their teeth.
Okay.
And they're just letting time pass until someone tells them it's time to pull the trigger and do it. Okay. And so those patients come to see me, and I'm able to give them some hope. I look at their mouth, and most of those people, if they're healthy enough to walk through the door, they're healthy enough to walk out with permanent teeth. I'm able to see those patients. They'll come see me after the first visit. They're going to come back. We're going to evaluate their teeth. We're going to do a design of their smile, and then the next day they come in. We remove the bad teeth, clean up the gums, and in the same day they'll walk out with teeth that don't come out. Beautiful smiles.
Now you make these teeth in your office?
In office.
Like you have a digital printer.
We have a digital printer. We have a digital printer. We also have a mill, which is a specialized laboratory piece of equipment, which allows me to make your permanent final teeth in office.
Right there.
Right there.
Now, I'll put you on the spot because I asked you this in the green room. If somebody's watching this today, right, and if you had time on your schedule, they have really bad teeth and gums, or maybe they're wearing a denture. If they came in tomorrow morning, right, to meet you for the first time, how soon before, if everything works out, how soon could they get their new upper and lower teeth that don't come out?
If they came and saw me first thing in the morning and they caught me on the right day, we could do it that same day.
Really?
That same very day.
But typically, how does it happen?
The next day or that week.
Just like two visits.
Two visits. One visit for evaluation, and then we design the smile behind the scenes, so you don't even have to come in for that visit. And then on the second visit, you're walking out with your permanent teeth that don't come out.
Yeah, but what about people with bad gums, like gum infection or gum disease? Aren't their gums too bad to hold the implant?
Those are my patients.
Okay.
The patients that come to see me with the bad gums, those are the individuals I want to see. Because I'm able to take those patients that have bad gums, we remove the bad teeth, we clean up the gums. Once the bad teeth and the gums are cleaned up, the problem goes away.
How old can you be? Like, what's the upper range of age?
I've had a patient in my office, 92 years old.
Really? Why would a 92-year-old want to do this?
A 92-year-old wants to enjoy their life. There's no upper limit on how long we're going to live.
So you're not too old.
You're not too old. If you're healthy enough to walk in the front door, you're healthy enough to get dental implants.
Now, I interrupted you. That 92-year-old, what'd you do for them?
They came in, we evaluated. They'd been wearing a denture for a while. They had some bone loss. They were told they might not be a candidate for dental implants. We were able to very confidently put those implants in, and they were able to walk out with permanent teeth. He was in for a cleaning last week. He tells me he eats steak 3 times a week.
Is that right?
3 times a week, steak.
Now, you say every once in a while, patients will say that you've changed their life.
You know, I don't change lives. They change their life by having the courage to take that first step, to call the office, to recognize they want to make a change in their life.
Okay.
They call the office and come in. I help them along the way, but the changes comes from within. They're so happy with this new lease on life that they have. They can eat things they've never eaten before. They can smile like they haven't smiled in years. It's like going in a time machine for these patients. They get to start over.
Is it like a third set of teeth? You got your baby teeth, adult teeth, you lose those, now you got this other?
I love it. We're going to call that your third set.
Is that right? I mean, is that an overstatement?
It's
but that's
real,
what it is.
It's not an oversimplification. It's like a third set of teeth. It's like a new lease on life for these patients.
And you were telling me a story of a woman that you gave new upper and lower teeth, and at her office or at work or somewhere where people were like wondering, I'm paraphrasing you completely, but like what's gotten into her?
She was all of a sudden smiling and talking, and she looked different. She acted different. And my advice to her was, here's the secret, Randy. I told her to say, when they asked her, what's different about you? You look different. Because people will when you get a new smile, people are going to look at you differently. And my advice to them is I say, and here's the secret, I say, you just smile at them and say, I got my teeth fixed. And then I say, make sure you tell them Dr. Miller took good care of you.
Okay. And so people do notice a difference. I mean, do you see the differences in personalities? Because it seems like it's just teeth in a way, respectfully.
Absolutely.
But you say it's a big deal for some people.
It's a window to your life.
Okay.
Unfortunately, in this world, in movies, in TV shows, when they want to make someone look poor or sick, they always make their teeth look bad.
Okay.
Right? And unfortunately, people are judged by their teeth.
Do they tell you that?
Oh yeah, all the time.
Like they're uncomfortable around
They're uncomfortable
other
around people. They're uncomfortable with their smile. They're uncomfortable in social situations. So they stop going out. They stop smiling. They don't open their mouth. And so when you get these new permanent teeth, it's like I said before, it's a new lease on life. You get to experience life like you've always wanted to.
Now, we joked about that the most expensive part is going out to eat all the time.
Yeah.
And things like that.
Your grocery budget's going to go up.
Is that right? Do you hear eating stories all the time?
Oh yeah, I hear all the time how much more fulfilling life is for these individuals. Where when you're wearing a denture, you have this sheet of plastic up against the roof of your mouth, and it's uncomfortable, and you can't feel your food, you can't taste it. Imagine eating an ice cream cone and not being able to feel that delicious taste against the roof of your mouth. And now we put someone in permanent teeth that don't come out, and they can experience those delicious foods again that they haven't been able to experience for a long time.
Now, correct me if I'm wrong. The way dental implants, as of today's date, are typically done is in 2 different offices. You go to one office where they do the implants, and you go to another office where they put the teeth on top and get them maintained elsewhere, maybe even 3 offices.
Oftentimes 3 offices.
Now, we do all 3 parts. Is that why you do it so quickly?
Everything in-house. That's how we're able to do it so quickly, and I add more affordably than most dental offices.
Okay.
Because we can do everything in-house. We have 3D printers that allow us to print your teeth same day. We have a laboratory grade mill, 2 of them, that allow me to mill your permanent teeth in office and finish them in office. So I can custom make your teeth to your specifications in office.
So you could charge less because of that?
Absolutely. It allows me to provide you this service without having to pay a third party to do it. And I'm able to give you more quality, a higher quality care in office with more attention to detail for a lower price.
Detail meaning the teeth look better.
The teeth look better. There's no cookie cutter smiles in my office. We make those teeth custom to you.
Now, I did some research, right?
Yeah.
And I know your prices.
Yeah.
You're more than half the cost.
Yeah.
When you compare apples and apples than other offices.
Is
that true?
It is true. People are not going to like to hear this. Some people aren't going to like to hear
You mean
this.
some offices?
Some offices aren't going to like to hear this, but my patients love to hear this. And they'll travel from a long distance to come see us because our prices are so affordable.
Now, you're training.
Yeah.
After dental school, when it comes to dental implants, how long have you been studying dental implants?
18 years I've been studying dental implants. I've been studying dental implants for 18 years. Permanent teeth for over a decade.
Okay. Permanent teeth, I guess there's two types. There's the snap-in, snap-out teeth.
Yeah.
And then there's teeth that don't come out.
There's snap-in. Yeah, there's your snap-in. Sometimes we'll call an overdenture or a snap-in denture, which have their place.
Okay.
They have their place because of certain reasons, sometimes mostly budgetary reasons. They have their place.
Can they graduate to teeth that don't come out?
Yeah, absolutely. You can absolutely graduate from that. Sometimes I see that as a stepping stone. People have to get comfortable with their budget. They have to get comfortable with what they're comfortable doing, what level of procedure they want. Sometimes someone has an existing denture and they just want their lower denture just a little bit tighter and they're just not ready for the permanent step. And so they'll come to see me and I'll say, look, I had a lady come see me, patient, her name is Monica, and she had a lower denture. And it fit okay. She was young. She was in her 40s. And she just was so nervous about it coming out because she did corporate training and she was in front of an audience.
She was worried her denture was going to
She
flop
was
out.
so terrified it was going to pop out. Like you see on like America's Funniest Home Videos.
Yeah,
When grandma blows her birthday candles out and the teeth come out. She was so afraid of that. And so, but she just wasn't ready for the commitment to the permanent teeth. And so I said, Monica, here's what we can do. You have great jawbone, because she was only 40s. She had great jawbone. We were able to put 2 dental implants on her lower jaw, and we were able to take her existing denture and fit it so that it could snap in and out. And she was so happy with that. Such a change in her life. She told me every time she comes in, she goes, Dr. Miller, I'm so happy with these lower teeth.
Is your goal to get her into teeth that don't come out?
Absolutely, when she's ready. When she's ready. I'll absolutely, I don't treat teeth. I think I told you this before, Randy. I don't treat teeth, I treat people. I tell people what I think the best option is. I help guide them into the best scenario that I think is going to be best for them. But ultimately, you have to decide for yourself.
You believe in this procedure?
Oh, absolutely. Absolutely.
I mean, your dad.
Yeah, my dad.
Didn't he get this done? Like upper and lower new teeth on top of
my
implants?
dad, Charlie.
Okay.
When I was a kid, I remember him having dental problems. And I wasn't a dentist then, so I didn't really understand. But he had lots of problems with his front teeth. He had to get I remember hearing him get root canals, and he had something called a cantilever bridge. I was fascinated by it when I was a kid watching him floss because it was so interesting.
Okay.
And so I knew his whole life he always had dental problems. He grew up in the 60s, and the dental care back then wasn't as good as it was now. And so when I graduated from dental school, he had all of his teeth, but most of them had already been crowned and root canaled. He had lots of spacing. And
so he didn't like his teeth?
He didn't like his teeth. Well, I think at first he had accepted that's who he was. But then over time he realized that he wasn't liking his teeth. And then he started having, once he hit his 60s and late 60s and early 70s, he started having quite a few problems with his teeth. And so over the course of about a decade, in seeing my father, again, I don't have a one-size-fit-all approach. With my father, he was happy with most of his teeth, but when a few would fail, we'd put a dental implant in to replace it, or we would do a dental implant bridge. And over the course of my 18-year career, I've taken my father, who has had a mouth full of failing dentistry, to a healthy mouth full of permanent teeth on dental implants. Now he can eat whatever he wants. His favorite thing, Randy, is he likes to bite popsicles with his front teeth.
Okay.
He loves it. He loves it. But he can eat anything he wants, and he can do it with confidence.
And all of your patients, they wish they would have done it earlier, you say?
I don't get a lot of complaints. In fact, I get 0 complaints on the permanent teeth. The only thing I hear is this: I wished I hadn't waited so long.
Is that right?
Oh, it's almost like a little tragedy.
I know a couple of denture wearers. They never complain about their teeth. Are you saying there's no such thing as a happy denture wearer?
Randy, they're not complaining to you because you're not a dentist.
Okay.
I've never once in my career ever have had someone tell me, boy, Dr. Miller, I sure love wearing this lower denture. I've never had that statement.
So no more dentures?
No more dentures.
All right. Now, you brought a photo. What are we looking at?
I did bring a photo. Would you like to see?
Let's take a look.
This is one of my favorite patients.
Okay.
This is Judy. She came to see me last year, came to my office, and expressed to me that she was so unhappy with her smile. And you can see, look at her smile. It's kind of misshapen. The teeth are misshapen, and there's dark staining, and she's only kind of smiling. You can't see her lower teeth. You know why?
Why?
That's a denture.
So those upper teeth are dentures.
Those are dentures.
It's a broken denture.
It's a broken denture that she had admitted to me that she had super glued together herself.
Oh, wow.
And she's not the first patient that has done that. I know many patients that do their own denture repairs because they're embarrassed. I mean, she had been told by numerous dentists that she could not get implants, that she wasn't a candidate because they told her that she didn't have enough bone. And they scared the heck out of her by saying that she's going to need bone grafting. Oh, that was scary for her. She was so terrified.
Okay.
And she thought that meant going to the hospital in the operating room, and she was just absolutely terrified. Well, she came to my office. I was able to look at her mouth and was able to determine that she was a candidate for permanent teeth. And it didn't require any bone grafting. It didn't require any of the things that she was scared of. She was scared it was going to hurt afterwards. She was scared that she wasn't going to be able to function, and she was scared that she had so many fears about the procedure. Well, we were able to give her some medicine to help her relax.
Okay. She
She slept through the whole procedure, and she came out same day with teeth that don't come out.
Did you do the upper and lower?
We did upper and lower on Judy.
Let's take a
I'm
look.
going to call her now. I'm going to say, this young lady, look at that smile.
Very nice.
Look at how happy she is. She is so happy to walk. She's like a light when she comes into my office now, just a shining light. She has her granddaughter as her caregiver, and was always accompanying her to her appointments. And Judy told me at the last visit when she came in that her granddaughter is a little annoyed now because now Judy always wants to go out. She used to stay home. In fact, she told me before she got this procedure done, for almost 20 years, she didn't want to leave the house. She didn't want to go
Really?
to the,
Because of her teeth?
because of her teeth. She didn't want to go to the store. Okay? Now, she just wants to go out. She wants to be out. She wants to talk to her friends. She wants to go to lunch and enjoy her foods. And she has told me that she gets to enjoy her favorite foods. In fact,
It's like a big boost to their self-esteem.
oh, huge boost to her self-confidence, her self-esteem. I mean, you can see it in her eyes. Look how happy she is there. Look at that big smile. She is so happy. So I sent you these clips of her actually telling us these things that I'm telling you now. Can we show those clips now?
Let's go to those clips. And this is her after she got her brand new teeth.
This is after she got her brand new teeth.
Okay.
These are her permanent teeth. And this was only 4 months after the first visit.
Okay, let's go to it.
My kids were eating, my babies were eating better food than I was.
What can you eat now that you couldn't eat before?
Everything. You know, my first thing was lettuce, a salad, a cold salad, and I could hear the lettuce crunch. And that was more exciting and tasted better than anything I've done in years. Getting up, getting dressed, putting back on makeup, I'm alive. I'm alive. I go out and I see people. I had been years in the house. Everybody, well, they can say the change. It's been unbelievable. It's just unbelievable.
Very nice.
Randy, that's everyone.
They all say similar things?
Everyone says that. Judy is a representation of all of my patients. I have another patient that came in. The story of Judy reminds me of another patient.
Okay.
He's a criminal defense attorney from out of state, came to visit me, and when we saw him, he was so unhappy because his front tooth had broken off. But the rest of his teeth were pretty bad too. And he confessed to me that he knew the rest of his teeth were pretty bad.
Do you think he was going to end up in a denture?
He thought that was where he was going.
Okay.
And he was so sad about it. And he had heard what we can do. One of his friends told him what we could do.
Okay.
He drove 6 hours from California
Okay.
To our office. And he was just kind of desperate. He was desperate for a solution that wasn't going to be a full denture because he had been told by his previous dentist at home that that was his only option. So he heard what we could do. We were able to look at his mouth, and yeah, Randy, his teeth were in pretty bad shape, and we knew that they needed to come out. The good news was he had great jawbone. So what do? We look at his mouth, we're able to take out all of those infected teeth, clean up his gums, and give him permanent teeth and walk out with permanent smile the same day.
What does he say when it's all done?
He was dumbfounded. He was for a defense attorney to have a loss of words was a compliment to me.
Okay.
He really didn't know what to say. He was so happy with his smile. He's told me that now he can eat and enjoy things that he wasn't able to enjoy before. He can eat a hamburger now. He's so happy. He told me that he's just so happy that he can bite into a sandwich or a hamburger without worrying about his teeth breaking off.
What do they like when it's all done? Do they like the way it looks or what they could eat? Or is it a combination of both?
It's a combination of both.
Like, do some people come in for one thing, like, I just want it to look good? They end up loving the eating part, or vice versa?
Absolutely. Some people come in, they want the looks. They want it to look really great, and then they're so surprised at how functional it is and how much they can eat the things that they used to be able to eat.
It does seem painful, though. I mean, the procedure itself seems painful.
I'm sure that's what people think, but you're numbed up.
Okay.
You don't feel a thing. Most people take some medicine to sedate them, so they sleep through the entire procedure. In fact, they wake up and they'll tell me, I don't remember a thing. They just wake up with their permanent teeth in their mouth.
Okay.
With a new smile. In fact, I brought a clip of that other patient telling you her experience.
About pain and things like that?
About how pain-free it was.
Okay, let's go to that clip.
Within a couple of days, I didn't even take one of the pain pills when I left here. Nothing.
Okay.
Went home, went to bed, up and down for a couple of days. Nothing major. Nothing like I really, really expected.
So it was easier than you thought it would be.
Oh, yeah. I'd do it again.
It's very nice.
Yeah. Isn't that
she
great?
had to say.
How nice is that? I think what I like about what she had to say there was it answers most people's fears. Most people are afraid it's going to hurt. They're afraid they're going to be down for many days. And what I get from most people is, to be honest, most people will say, I'm just a little sore. And that's kind of about it.
When we think of Arizona, especially here in California, you think of hikers and health. Are there really a lot of people with bad teeth where you are?
I mean, there's 8 million residents of Arizona. There's probably enough denture and partial denture wearers to fill any sports stadium in the valley. Cardinal Stadium could be filled to capacity with denture patients.
Why don't they all do it?
I think they don't know. I think
they don't know their options.
I think they don't know their options, or they're afraid, or they're afraid it's going to cost too much. They hear these outrageous numbers. They read online these outrageous prices, and they're afraid.
Well, if they Google it in your area, you're more than half off of everybody else.
Yeah, they'll find it. But that's
quality, why is quality still there though? I mean,
absolutely.
You put a low price like that.
Absolutely.
Because that's what I was thinking.
Quality doesn't suffer because I have the equipment in office to make the teeth. The reason most of those other prices are so high is because the dentist has to send out to a third party.
They're outsourcing everything.
They have to outsource everything to a third party, and that makes it take longer. It increases the cost, and it also lessens the predictability of the outcome of the results. I want to be able to give patients predictable, efficient results. And that's what they get when they come see me at Mesa Dental Implants and Dentures. They get predictable, efficient results.
Now, we're short on time.
Sure.
So if it's been determined all their teeth have to go or they're currently wearing a denture, how many actual implants do they need? And what are their options when they go to your office?
So I like to give people like the door number 1, door number 2, door number 3 option. Okay. Because like I said, I don't treat teeth, I treat people. Okay. I really want my patients to pick door number 1, which is the permanent teeth. And with a permanent teeth, you're typically going to get 4 to 6 implants on the upper and 4 to 6 implants on the lower to support those permanent teeth.
For a full set of teeth. Okay.
Yes. Now, door number 2, which is still a good option, is a complete denture on the top, and on the lower we do 2 to 4 dental implants to make what's called a snap-on denture.
Okay.
And I will tell you that it is a good option for a lot of people. Obviously I want my patients to take the premier treatment, but I also
teeth that don't come out.
Teeth that don't come out.
Okay.
I obviously want to give my patients the option to have teeth that don't come out, but that doesn't always work for everybody. There are sometimes factors that we can't control. And so I try to give them options that will work for them in their life. Okay. And so a snap-on denture sometimes is the option.
Can you convert them later?
Absolutely.
To teeth that don't come out?
It happens more often than you think. People will come to me, and that's why I try to get them to do door number 1, because a lot of times patients will get the snap-on denture and then they come back and see me 2 or 3 years later and they say, Dr. Miller, I really wish I'd done the permanents from the very beginning.
So when they get so you've done a couple of people that had a snap-in and now they have, what do they say when it's all done, when they get the?
I wish I'd just done it from the beginning.
So it's that much different to get the teeth that don't come out?
It's so much, it's night and day difference. Permanent teeth. You don't have to, look, you don't have to take it out and put it on your nightstand. You know, you don't have to take your teeth out and put it in the glass on the counter. You can just go to bed at the end of the night, brush your teeth and go to bed like you did when you were a kid. And then there's door number 3. For some people, a cosmetic denture is the option.
Are the dentures better fitting than they were before?
Absolutely better fitting.
They look better?
And again, we make them in office. So there's not a long wait, and they're very affordable.
You save teeth when you can. You
Absolutely.
say we save teeth, which saves money.
Absolutely.
Because you just don't do one thing at your practice.
Correct. There's no one size fit all in my office. Some patients come in and they've heard about dental implants and they're maybe missing 2 or 3 teeth, but they think, my teeth are still pretty good. How do I fix these missing teeth? And so they'll come see me and I'll very easily put 1 or 2, maybe they need a deep cleaning, maybe they need some basic dentistry and to replace some missing teeth. So those patients will assess them. They're not a candidate for the permanent teeth, but they are a candidate to replace the missing teeth with a single dental implant. And that's very simple. And again, we do everything in office, place the implants, make the permanent teeth in office.
Now, at what point do they get to see you in this process?
From the very beginning.
Okay.
They see me, they walk through the door, they see me at the first visit. I'm there to greet them. I'm there to do their consultation, and I'm there for the surgery.
For people that have really, really bad teeth and their option is a denture, if they knew how good this was, are you convinced, after helping so many people, that if these people with bad teeth and gums or dentures knew how good this was, they would all do it?
They would all do it.
And there's not even enough dentists to even help these people.
There isn't.
If there's 30 million, I Googled it, 30 million people wearing a denture. There's only like 300,000 dentists.
Yeah, there's not enough people to actually fit the need. If they realized how great it was, they would absolutely do it.
Is this the future of dentistry, whether it's 20 years or however many years, that dentures as we know them, do you think they'll be gone? They'll all be attached to something in the future?
I think so. In my career, I've seen so many changes in 20 years that I am very hopeful for the future that we're going to see this as the gold standard.
We're out of time.
Thanks for having me.
Final message, though, to the 2 groups. They're wearing a denture or they have really bad teeth and gums. They've heard what you have to say, but for whatever reason, they're skeptical. They're afraid. What do you say to them?
I would say to those people, come in. Let me see. Let me tell you what I can do for you. Let me tell you what your options are.
You give them the 3 options, door number 1, 2, and 3.
I'll give them their options. But again, and I'm going to finish with this. I don't treat teeth, I treat people. Okay. Come see me and I'll treat you like a person. And we're gonna become friends.
Okay, good. I want to thank you for coming to the show.
Thanks,
good
Randy.
stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.